So in today's medical system, what frustrates you the most about how patients, especially underserved ones, are treated in your industry?
You know, it's crazy because I started my career working downtown as a CNA at Northwestern Hospital. And unfortunately, they didn't treat us right then. They don't treat us right now. You know, working in these ERs and seeing a white lady can walk in there pregnant and they gonna take her off her feet and take her straight into the back and see about her. A black person gonna have to sit in the waiting area. They gonna think, oh, she really ain't in labor. We come in there, we in pain. They don't give us pain medications because they think we're drug seeking because we're black. And white people that come in there, I know for a fact they dope fiends. Guess what? They
Giving
getting
it to
them all
them.
the good stuff, and I'm
Right,
like, this the dope fiend.
right.
But you know, me being boisterous and speaking up, they didn't like that. So you know, my career was short lived at Northwestern because they like this
Around
little
what
black
year
girl
was this
think she is.
Northwestern? About around what year?
2002,
Early
2000,
2000s?
yeah,
Okay.
early 2000s, and then I ended up at Mount Sinai Hospital in the ICU. It was a lot of us over there, you know, west side of
West Side.
Chicago. So I can't say I saw anybody being mistreated because it was a black hospital and it was black staff.
Right.
So, but yeah, you definitely see it. University of Chicago is right in the black neighborhood. They mistreat the blacks too. You go in there,
Kenwood area, right?
yeah,
Yeah.
yeah, we get mistreated by our own over there.
Oh,
So it's like you damn if you do, you damn if you don't. But and definitely working the floors, you know, the white nurses, the Philippine nurses, they was able to get the good shifts. They got treated better than we did. You know, we had to show them what we was about. You know, me coming on the floor, long weave, they automatically, oh, she ain't finna do no work. And then when I come over there and run rings around them,
right.
everybody like, oh,
Uh,
she know what she doing, and we can learn something from her.
exactly.
Yeah, so you know, it was for sure stereotypical about because one, I was young, black, and the way I looked, they thought I was lazy. They thought I went into the field just to make money
Right.
versus little white girls, they go into the field because they care about us, you know.
Exactly. You had a
Yeah.
purpose.
Yeah, even with nursing schools, I went through so many nursing schools and quit and cried and failed because they was prejudiced. Rush, oh baby, them teachers basically told us if you're not the typical white female, they didn't even like white males back then. They used to tell us they weren't passing us.
Oh, wow.
Yeah, so I had to leave Rush and go to a junior college just to get a degree because
Mm-hmm.
they were so prejudiced. They didn't
Prejudice.
want us.
And what about some of the other degrees you got in the medical field? 'Cause we know you're a doctor, so let's talk about that path.
Yeah, climbing the ladder of success, it was like I always wanted more. So I went from being a CNA to LPN, got my associates in nursing from Triton College. I had to go out west because Kenny King, Olive Harvey, they was playing with us too. They 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 weren't even letting us in. The waiting list 3-4 years. So I
Oh,
let me
wow.
go to a private white school, Triton
Okay.
College over in River Grove, Illinois,
Mm-hmm.
and got my associate's degree. Then I got my bachelor's degree in nursing from Benedictine University. And I was like, yeah, it's not gonna stop here. I went into management and I saw that although I got this bachelor's degree, I'm black, right? They bring these white girls in here with associate's degree, and they still want them to run up. They want me to be the face, but they wanted this white girl to really run the office. And I'm like, no, okay, it's time for me to go back to school because this bachelor's degree still, I ain't getting my respect, right?
Right.
So I was like, okay, I'm gonna go back. I went to Olivet University and got my master's of science in nursing. I became a family nurse practitioner, got that DEA license. I was like, I did it right. I made it right. Wrong.
Wrong.
They still was like, well, mistreating you, and you know, I'm working for certain companies, and they like, well, why you keep going back to school? Why y'all keep going back to school? Why I can't want a higher degree?
Right.
What's pushing you? What's pushing you? What's motivating? Bitch, what's motivating you? I used to get offended because, you know, it was okay for the other races to go back and want a higher education. When we wanted to go back and get a higher education, it was frowned upon. They looked at
Right.
us like it was something wrong. And then I had a few friends who had doctorate degrees, and after my master's, I was like, I'm done. I'm sick of these people. I'm sick of doing this, sick of doing that. And I was like, okay, overachiever, right? Let me go back to school and get this doctorate degree. And
How long did it take you to get the doctor's degree?
it took me a little longer because in the process of me being in school for that, Greg was murdered.
Okay.
So I thought I could still finish school, end up failing a class or two, took some time off, and then I went back and graduated during COVID. So I really walked across my living room floor in Atlanta, Georgia, and that's how I ended up with a doctorate degree.
I'm glad you said Atlanta because I was finna get into that because you was practicing your doctor's degree down there too, right?
Yeah, so yeah, I originally was working for Optum United Healthcare, family nurse practitioner, seeing patients, in-home visits, and also was traveling to different states, taking over caseloads for different other EMPs. And once I got my doctorate degree, things was just different. And during COVID, you know, I risked my life seeing these patients during COVID, and they decided they wasn't gonna give me my bonus.